COVID second wave is like a big tsunami. It's now sweeping across the community and looks like we are witnessing the peak of the pandemic in India. Every day we are witnessing thousands of people diagnosed with the disease, and the hospitals are full, and we doctors are finding it very difficult to arrange a bed for our patients in our hospitals. Friends, when the first COVID wave came, it was mandatory for a positively tested patient to be admitted in a hospital. This second wave, considering the number of new infections, the health experts and the government are advising to treat milder patients at home. COVID infection is mild in 99% of cases, and about 1% of patients end up having severe COVID illness, and this subset of patients are very sick and they don't make it in the end. We are seeing the trend of younger patients getting the severe form of the disease and dying. In this video, I will discuss about the mild COVID infection and how you can treat yourself at home without any issues. Hello and welcome. This is Dr. Arun Naik, and I am a neurosurgeon and a health blogger. I work in a very busy private hospital at Bangalore, which is now a dedicated COVID hospital, and I am involved in the care of COVID patients with a brain stroke. If you are new to the channel, please consider subscribing to DocLogs. The initial symptoms of COVID-19 are like any other viral illness: feeling unwell, runny nose, mild cough, and that body pains. At this point of time, when the pandemic is peaking, every viral illness is considered COVID unless proven otherwise. So, what to do when you have the illness? First thing, isolate yourself at home. Treat your symptoms with medications and take an online consult with your doctor. Wait for 3-4 days and then get yourself tested. Why 3 to 5 days? We are now seeing negative reports in early testers. What test? Throat swab, RTPCR. This is the gold standard for diagnosing COVID. However, these days the report may take a couple of days because of the rush. So continue home isolation till the report comes. There is also a rapid PCR test called PCR lamp test, that is loop mediated isothermal amplification test, which takes less than 10 minutes to report and is as good as RTPCR. This is a little expensive test, and I do this test in all my emergency cases where I need to take up COVID suspected stroke patients for their brain surgery. So what to do if you are tested positive? Two things. The first thing to do is to report to your health authorities and get registered. This way, if you wanna get admitted later, it's very easy to arrange a bed. Number two is to get a doctor online video or audio consult. He may prescribe some more tablets, which I cannot mention here because they are all prescription medications, and these may be according to your local government guidelines. You please don't visit any clinic or hospital and mix with other patients in his or her clinic. Be a responsible citizen. What are the things you need at home? Friends, you need 3 things, and they are all easily available. Number 1, good quality pulse oximeter. This measures the oxygen saturation in your blood. This is the most important parameter in COVID illness for monitoring. Just insert your finger correctly into the oximeter sleeve and check your numbers. Oximeter records 2 parameters. One in big font is your oxygen saturation, something like 95, 96, 97, etc. There is another smaller font number for your pulse rate. This reads anywhere between 60 to 80 or more if you have fever. So this is your pulse rate. Number 2, digital thermometer. This records your body temperature. Just switch on the equipment and put it under your tongue and wait for the beep. It will give you the reading in Fahrenheit or centigrade. In India, we follow Fahrenheit. Most of the doctors, we follow Fahrenheit for temperature. Number 3, Paracetamol tablets of 500 mg or 650 mg strengths depending upon your body weight. This can be easily purchased over the counter. This is very useful for that fever and body pains. Now, what are the things to do inside your room? Friends, take rest. Get plenty of sleep. It can make you feel better and may speed up your recovery. Stay home from work, school and public areas unless is to get a medical care. Even if you are going for medical care, avoid using public transportation or ride sharing services or taxis. Stay isolated in one toilet attached room in your home, away from your family and other people, and you should be the only person in that room. If there are 2 infected people, they can stay together. Eat inside your room, open windows to keep air circulating. Avoid shared space in your home as much as possible. If you want to use shared spaces, limit your movements. Stay at least 2 meters away from your family members, that is 6 feet. Always wear a mask when you are in a shared room. Inside your room, there is no need to wear mask. Wear a well-fitting medical grade N95 face mask when coming out. Change the face mask every other day. Clean touch surfaces such as doorknobs, light switches, electronics and counters every day. Avoid sharing personal household items such as dishes, towels, bedding, chargers, electronics and needless to say that toothpaste. Frequently wash your hands with soap and water for at least 20 seconds or use an alcohol-based hand sanitizer that contains at least 60% alcohol. What about laundry? Be careful with your dirty laundry. Don't shake your dirty laundry. Use gloves to handle the clothes. Use regular detergent to wash the laundry. Use the warmest setting of your machine you can. Wash your hands after putting clothes in the dryer. Thoroughly dry clothes. Wash your hands after removing the gloves. Place dirty gloves and your used masks in a waste bin with a lid and dispose according to your civic guidelines in your area. Use different utensils and dishes for yourself. Maintain a daily routine including showering, shaving and changing dresses every day. Maintain good hygiene. Take breaks from those COVID-19 news channels. Now, what is the diet change to consider during isolation? Loss of smell and taste will make you more sick and you don't feel like having food. Number 1, drink fluids. You lose more water when you are sick. Dehydration can make symptoms worse and cause other health problems. Always drink 2 liters of fluid per day or more. Tea with honey is comforting and the honey also may help calm a bad cough. You probably don't need special electrolyte drinks, but if you have diarrhea or vomiting, they may be helpful. COVID patients should opt for a balanced diet, rich in reasonable carbohydrates, protein and unsaturated fats. As for protein, patients can consume fish as well as boiled eggs. Chicken can be consumed in small quantities. However, chicken soup may be useful. Avoid red meat at any cost. Dishes must be prepared in olive oil, soybean oil or canola oil as these are good fats. The diet should be rich in vitamins and minerals. Add a spoon of turmeric powder to a glass of hot milk and consume 2 times a day. Turmeric contains curcumin, which is a known immune boosting food. Eat 5 to 7 small meals throughout the course of the day so that digestion will be seamless. Have khichdi with vegetables. Also, fermented rice, kanji, and other foods will aid in faster recovery. Vitamin C is a COVID fighting vitamin. Consume 350 grams of grapes or sweet lemons, mosambi, into 2 meals for daily dose of vitamin C in the diet. Avoid high fructose containing fruits because high sugar is not good at this point of time. Consume multivitamin tablets having B complex vitamin C and zinc, as these are great recovery agents for COVID infection. Stop alcohol and smoking completely. Both are not good for recovery. Next important thing is breathing exercises. The most important organs during COVID times are your lungs. Normally at rest, we only use about 60 to 70% of our lung capacity for ventilation. During COVID infection, there is some stiffness in your lungs. So you should open up the closed lung spaces so that you can get good gas exchange. Do deep breathing exercises every hour for 5 minutes. Here is how to do it. Sit comfortably on a chair, close your mouth, slowly take in a big deep breath through your nose, allowing your belly to rise as you fill your lungs, and hold it there for a few seconds. Try initially for 5 seconds and then increase it to 10 seconds to get maximum lung expansion, and then exhale the air completely like this. By doing this, that number on your oximeter goes beyond 94, no doubt. After some time, take steam inhalation for 15 minutes. Actually, steam is advised morning and evening. Warm water gargles with added salt is advised twice daily. If you have chest discomfort, sweating, dizziness, or palpitations when you do this, please contact your doctor. Now, how to monitor yourself? You need to monitor 3 things. Number 1, and the most important thing, oxygen saturation. Make sure that your readings are 94 and above. If it drops below 94, don't worry, it happens many times. Take some deep breaths and take another reading. Mostly it will come up. If consistently your reading goes to 93 to 90, inform your doctor. If it goes below 90 again and again, then it's the time to search a bed in the hospital. Dial your doctor. Number 2, temperature. If you're consistently having high fever, contact your doctor. You may need more blood tests to quantify your illness. Number 3, breathing difficulty. If you're unable to walk to the washroom, or if you're unable to finish a full sentence, that means you're breathless. Reach out for help. The other question asked is, what about the exercises? COVID causes a lot of spasm in your muscles, so I advise all my patients to avoid any heavy exercises. They can walk inside the room for 15 minutes thrice a day. This will loosen your back and limb muscles and prevent those deep venous blood clots in your legs due to prolonged resting. If you were practicing yoga earlier, you can perform mild stretches, but definitely no treadmill or weightlifting or jogging. What about previously prescribed medications? Please continue all your previous medications without any issues. Let's now discuss the danger signs. Number 1, very high fever. Number 2, trouble breathing or tightness in the chest. Number 3, persistent chest pain and heaviness. Number 4, extreme sweating. Number 5, brain fog or drowsiness. Number 6, bluish lips or face. Number 7, excessive sleepiness. You need to dial your doctor and search for a bed in a hospital in such a situation. Friends, how long the isolation lasts? talk to your doctor. You have to fulfill these 3 things. First, you shouldn't have fever for 3 consecutive days. 2, your respiratory symptoms such as coughing or shortness of breath should be better. Number 3, it should be at least 10 days since your symptoms began. Who shouldn't take home treatment? As a rule of the thumb, if you are physically fit before COVID, you can opt for home care. If you are over 60 and if you had uncontrolled or poorly controlled health issues like diabetes, high BP, heart disease, brain stroke, lung, liver and kidney disease, and you are not so physically active, you can opt for a hospital care if you get a bed. These factors put people at greater risk of becoming seriously ill with COVID-19. If pre-existing diseases were under good control, you can continue home care till you develop a complication, as I told. Friends, these are general guidelines from Government of India, Ministry of Health. Apart from this, there may be some local government guidelines in your states which I am not aware. Please follow them. Always be in touch with your doctor online because he is your savior. Most people who become sick with COVID-19 will only have mild illness and can recover at home. Symptoms might last a few days and most people start to feel better in about a week's time. With that, friends, we have come to the end of this video. Thanks for watching and hope you found this video helpful. Share this video in all your social media circles so that it will benefit the community. Don't miss my video on how COVID kills a patient and how we doctors are learning new things about the illness. If you need to know anything about COVID, let me know in the comment section. I'll be back with another equally interesting doclog very soon. Till then, feel awesome, live awesome, and take good care of your health. And if you continue to work, please wear a well-fitting N95 grade medical masks.